Okay, my name is Kate Whiting, and I decided to choose the topic of birth in home or in the hospital, and I will just be kind of talking about both of those today. Okay, first we have at-home births. What does a planned at-home birth look like? The mother chooses to have baby at home. It usually involves a trained midwife. This is someone that has somewhat of a training, 2 years or more of helping with labor and delivery, and they are super supportive, or they're people that know a lot of information and are just there to help mom and help baby come as safely as they can. It's usually done in a clean bed or a birthing pool that's often seen. And then it's a created safe environment for mom, and mom often feels super safe in her home, and it's her environment and not random people walking in. She knows everyone that's there and is a part of the birth. Okay, benefits of at-home birth. First is higher satisfaction for mom. Mom feels like her voice is heard at home. Trust her midwife or doula, or the person that's helping her through her birthing experience. There's no unwanted intervention of medication recently, and a newer trend that's been seen is women wanting their bodies to naturally give birth and not having the pressure in the hospital to get an epidural or receive medications to help with the pain. They see their birth as a natural experience and not something that needs to be helped with medication. They have better feelings of control because it's a safe environment. They know who's there. It's a close-knit circle. It's cost-effective and lower rates of maternal morbidity. And then maternal morbidity is a condition or a complication of birth or postpartum that women experience both physically and mentally. These can include hemorrhages, infections, baby blues, stuff like that. Is it safe to have a home birth? One of the experts I really liked says, while the majority of investigations of planned home births compared with hospital births have found no difference in postpartum fetal deaths. So if you're comparing the two, and I also think it's super important to remember that mom and baby are low risk for these outcomes. And looking at the evidence and the research, it shows that there isn't really that big of a difference between these deaths, between a home and hospital setting. So I would say that it is safe to have a home birth if you are taking the correct steps and having a midwife there and planning and preparing, and also being aware that medical care is available if necessary. Because at the end of the day, you and baby are what's most important. What does a hospital birth look like? Mother goes into labor, or often moms are induced. This word induced means they have a set date and time that they will come to give birth. Moms get medical interference if they need with medicine, epidurals, things like that to help with pain. And then mom and babies have health concerns, and so the hospital closely monitors them. And that's kind of what the hospital setting looks like. You're assisted by a lot of nurses, doctors. Your husband can be there, or whoever is supporting you during your birth. And I like this. It says as soon as it starts, aka birth or labor, I don't know how long it will last until I'm in the delivery room. And there's just people there to answer your questions in the hospital. And I'd say a larger percentage, statistically, a larger percentage of babies are born in the hospital. There are many possibilities with complications during childbirth, and the benefits of giving birth in a hospital is having medication and medical help. for pain and for baby safety and for mom safety, and continuous monitoring for mom and baby, which is super important, and a very well educated staff. There's pain relief options, again, the epidural and medications, and there's the ability to help assist the birth if baby's having a hard time or mom's having a hard time with forceps and vacuums. And there's also that quick option for a C-section in case of an emergency. If baby's not okay, if mom's not okay, it's a super available option that happens pretty more frequently during people's birth stories. Okay, statistics on home versus hospital birth. So I'm going to explain my graph I made. So half of it is planned hospital births. And so that half is for all of the planned hospital births that happen. 0.57% of these hospital births have prenatal deaths per 1,000 babies. And then per home planned births, it's 0.35%. So as you can tell, these numbers are super close. There's not that big of a difference for both of these statistics on being at home or in the hospital. And yet again, this is considering that mom and baby are low risk. And this home birth or hospital birth has been planned. Okay, some key words to take away from both of these sides of a home birth and a hospital birth are home births are births assisted and counseled by a midwife who gains personal relationships with parents to bring comfort and trust into the birthing experience. Midwifery, this is someone that has education and experience with birthing situations, and someone that's educated to help mom and dad work through this birthing situation and give ideas and support as they go through their birth. Medicated birth means that mom either received an epidural or medications to help relieve pain during her birthing experience. Cesarean section, this is often called a C-section. This is an emergency surgery, or sometimes it's elective, to get baby out through the stomach instead of vaginally, in case if baby's having complications or moms. There's many different reasons for this type of surgery. A doula is another person who has education and is there at home births to help assist and to help comfort mom and give ideas and give support as she's going through her birthing. And then birthing center, some at-home births were considered to be taken apart in a birthing center in a lot of these studies. And so if it was at home, but it was in a birthing center with a midwife, they also consider that an at-home planned birth. So that's just some of the key words to help identify and understand some of the things that are being said in here. Okay, as I did my research, my personal opinion on this matter is a planned hospital birth. And I list my 4 reasons: the risk of possible complication, justified medical interventions. This basically means that if there's complications and you're already in the hospital, it just makes things so much easier for mom's safety, baby safety. And then flexibility is necessary. Again, if you need an emergency C-section and you already have an epidural, you can just go straight in. You don't have to get an epidural placed or wait to get to the hospital and get an epidural placed and make sure the epidural is placed right. This way, it's more flexible for these complications if they do happen for moms and babies. Prenatal mortality is higher with planned home births. this is just talking about fetuses or stillbirths or things like that. And yet again, they are super close numbers, and it's hard to grasp and understand the range of the studies that have been done with who, high-risk moms, low-risk moms, and then not having to be transferred in case of an emergency. I think that would be my biggest fear, is being in labor, and having a complication, baby's stuck, baby's breech, and then having to go to the hospital and then receive that help that way. And then to the right are my sources that all of those came from, listed out. Super quick. I also feel this way because of an experience my sister went through. She and her baby were both low risk. She had a planned hospital birth. She was in labor for a very long time, multiple hours. They tried forceps to help assist baby out. They tried a vacuum to help assist baby out, and neither of those work. Baby's head was stuck under her pelvic bone, and so they had to do an emergency C-section because baby wasn't coming. And because she already had an epidural, there wasn't a wait time, and she was just able to get baby out for baby safety because baby's heart rate was going down as they were being monitored during her birth. And so you never know what's going to happen. Yet again, my sister was low risk, and so was her baby, and she ended up having an emergency C-section with her first kid. So, and I know she's grateful for the doctors that helped her and for the nurses that comforted her through this wild situation.